13. Common early signs of STIs. Because STIs often sneak around without symptoms. Knowing the subtle clues is your superpower. Remember, if you see any of these signs, don't panic. They might be something else, but they are serious enough that you need a checkup. Therefore, noticing them is the first step toward getting treated and staying healthy. Here are 13 common early signs that might mean you have an STI. 1. Unusual sores or blisters. These can show up on or around your mouth, genitals, or rectum. With herpes, they start as painful blisters. With primary syphilis, the sore is often painless, called a chancre. 2. Pain or burning when peeing, dysuria. This is a very common sign for bacterial infections like chlamydia and gonorrhea. 3. Strange vaginal discharge. This means more discharge than usual, or discharge that has a smelly or foul odor. 4. Discharge from the penis. If you notice dripping from the penis, it could be chlamydia or gonorrhea. With gonorrhea, the discharge may be yellow, green, or white. 5. A rash you can't explain. Secondary syphilis often causes a rash that isn't itchy and can look rough, red, or reddish-brown. It can show up famously on the palms of the hands and soles of the feet. 6. Fever. Feeling run down or having a fever, like you have the flu, can be an early sign of herpes or HIV infection. 7. Swollen glands. Your lymph nodes, glands, in your neck, groin, or other areas might swell up, often happening with the first herpes outbreak or early HIV. 8. Body or muscle aches. General aches, sometimes like the flu, can come with early herpes, secondary syphilis, or early HIV infection. 9. Sore throat. This might mean you have an infection in your throat, especially if you had oral sex. 10. Rectal symptoms. Pain, boreness, discharge, bleeding, or painful bowel movements in the anal area can signal infection. 11. Vaginal bleeding between periods. Some women with gonorrhea may notice bleeding when they aren't expecting their period. 12. Painful or swollen testicles. This is a less common but possible sign of chlamydia or gonorrhea in men. 13. Wart-like growths. Whitish wart-like lesions might appear on moist parts of the body, like the armpits or groin, during the secondary stage of syphilis. You should absolutely visit your healthcare provider if you notice any of these signs.